She has been a friend and client with me for a very long time, probably 6 or 7 years. She has volunteered today to come and do our first Facebook Live. I did say first, I threw that in there just so you all know watching this that, you know, stuff happens. So we'll go from there. We'll just make do. But Nicole has not had any kind of Botox treatments or anything in a while. She used to keep up with it a good bit. And so she's here now to get caught up on her fine lines that she doesn't like in the forehead and the glabella area. Before we get started though, I'm going to kind of go through a couple things. One of the things with my patients through the years that really my patients really appreciate is they'll always tell me when they come in for their treatments, Jenny, I really appreciate all the information you give me. You know, I'm not coming in here and you're just, you know, injecting me and out the door. I give a lot of patient information. We talk about expectations, but also really making sure that we understand what we're doing and why we're doing it. So a lot of times, you know, I teach nationally as well, and so I'll be traveling and I'll be teaching students all over the United States about these procedures, and I tell them, I say, you know, it's textbook. There might be 5 points or 6 points or whatever it tells you to inject, but not everybody is textbook. And so it's really important to understand the anatomy, understand what the muscles are doing and how they're working, and understanding that if you're getting Botox or Dysport or Xeomin, which are the 3 FDA-approved treatments for what we're doing with the muscle and nerve communication, that we understand how it's going to interact with each other. We want to make sure we're always in dynamic balance, and that we're making sure that if we're treating one area, everything else is going to look okay with it as well. And so talking to patients, talking to Nicole, we've already talked a little bit off camera, so we know what our plan is going to be, kind of understanding what she wants and making sure that what she wants, I know clinically it's going to turn out looking very good. We had talked about treating her glabella area, not treating her forehead. She came in thinking that she just wanted her forehead treated. But, you know, talking to her, we're going to go ahead and treat her glabella as well, because a lot of women and men, they'll have their forehead treated and then they'll just kind of get heavy in their brows. So you need to understand, a lot of my patients, you know, we talk about the rationale about what we're doing, why we're doing it. The forehead muscle, it's the frontalis, and it raises up our eyebrows. So we can raise our eyebrows and open our eyes up, and we're causing this expression, which is causing these lines. So if I knock out this frontalis area, she's going to probably get a little heavy. She's a little bit heavy already, not bad. She's kind of got a little bit of a shorter forehead. So versus my long forehead that can tolerate a lot of units. But her forehead's a little shorter, and we want to make sure that we don't get any dropping. But she's concerned about this line, so if I don't treat the frontalis, the forehead, it's not going to get any better. So we're going to also treat her glabella. We're going to treat the glabella because the glabella is causing these lines. Here we call them the 11s. These are kind of the anger lines. People say, oh, I look like I'm concentrating all the time. Even at breast, and you're so sweet and giggly, so I don't understand, you know, why you just look angry there. But she's pretty strong here, so we're going to treat this area. But to understand that the glabella is made up of a couple muscles. We've got a procerus here in the middle, and we've got our corrugator, and we inject different areas, whether we just treat the medial aspect or we also treat the medial and the lateral aspect. So go ahead and furrow for me, Nicole. So the procerus pushes up here, and she's got corrugator here, a little tail of the corrugator, and all these things work together that's causing this issue. One of the things I notice is when she does furrow, her nose doesn't really move, so we don't need to worry about treating the bunny lines on the side of the nose. But a lot of patients, can you scrunch your nose? We'll do this when they furrow.
It's not a natural movement.
No, it's not a natural movement, which is good because you don't do that. So you don't have these lines here, and you don't have really a line across the bottom of your glabella. So a lot of times, you know, patients will come in and say, oh, I've had this treated 5 or 6 times, I really like it. And then they'll go ahead and they'll furrow, and they come up, they've got this line across. And so we talk about, you know, needing to treat the bunnies on the side as well, and not just typically doing the textbook treatment. So it's really important that we do a full evaluation, understand that she came in to me today and said, I don't like this line. We're not going to just treat that line. We want to make sure that if I treat this line for her, that we're also making sure that we're treating other areas that can affect that line as well. So, and she's had treatment done before. Mm-hmm. We've gone through her medical history together already, make sure I've updated no allergy changes, any of those kind of things. We've got her consents. I have her pictures. That's something I'll do pretty much every time you come in. Get your pictures, get some consents. Answered all your questions before we started Facebook Live today. And so we're getting ready to start here in a sec. I just want to show everybody the 2 products that we carry here at Azura Skin Care Center. We carry Botox and Dysport. There's also a third, ZMN, that I will get for my patients if they request it. I've got 2 or 3 people that like to use it. But you know, being open about 5.5 months, I don't really have a need to carry all 3 at this point. So we've got the 2 products that we carry. This is somewhat important because patients are always asking me, you know, I heard places dilute that Botox down, or I heard them dilute that down. So let's talk about that for just a second. So when we get Botox, when we get Dysport, it actually comes, I don't know, Crystal, and this is Crystal who's recording us. Crystal is a physician assistant student from Campbell, so yay Campbell, give you a little shout out there. She's been absolutely amazing, so thank you for letting me have her. But Botox comes, and I don't know if you can see this. It looks like, what are we paying for? This is just a glass vial. But if you look real close, there's a little bit of a fine white powder, and that's what it looks like. I can't inject that into you. You see it okay? And so we have to reconstitute it with some sterile saline. And so we actually draw up a little bit of saline and shoot it into here, and then it makes it into a liquid, and that's what I'm able to inject. I'm not necessarily diluting it down or watering it down, but that's how it actually has to be prepared. Dysport usually looks a little different. There's a little more of a powder appearance in there, if you can see that. More of a white powder, kind of, sort of, Crystal's telling me. So instead of just that little bit of that white rim that we see, we actually see a little more of a powder. Same thing, we're still going to put the saline in here, reconstitute it. So that's what that means. We're not watering it down, we're not diluting it. There are different ways to reconstitute depending on injector preference, whether we use 1.5 or 2.5 or 3 cc's, you know, 1, 2, 2.5 is recommended for manufacturer. But that's what it looks like. Your bottle should pretty much always look like this. You know, Botox comes, there's a little hologram on here that if we really look close we could see. That tells us it was made in the United States and this is appropriate for use here. I didn't smuggle it in from another country. So if you're ever questioning your provider or you're not sure, you can always ask to see the bottles. But for most of the time, 99.9% of the time, I'm sure your providers are being very ethical and honest with that. But you can always ask. So after we reconstitute it, this is the one that I've already drawn up for Nicole today. You'll see it's you can see the liquid in there, and that's just where we had that little bit of a powder, and then we put in the sterile saline, and now we have a liquid, and that's actually what gets injected. So just wanted to kind of clear up that myth that I sometimes hear from patients where they say, oh, I heard that, you know, places water it down. You can change the reconstitution of it, but we have to use saline to prepare it because it does come as a powder. So, all right, you ready, Nicole?
I'm ready.
All right. So Nicole has had this done before, and she's
Clearly not in a while.
Clearly not in a while. You know, and Nicole is very beautiful. She doesn't necessarily need this, but it's her preference. So, you know, I tell people say to me all the time, do I need to have this done? I say, well, nobody needs to have this done. This is a cosmetic thing. But if it bothers you and you would feel just more confident, feel better about having it done, excellent. Let's go ahead and do that for you. We talk about how many units and very upfront about your expectations and cost and those types of things. But, you know, does anybody need it? Well, for medical purposes, sure. But when we're talking about the forehead, you know, if we're treating hyperhidrosis or doing some other medical things, you know, that might be a need. Or for migraines, you know, it's FDA approved. So with the Botox, Dysport would work as well. It just doesn't have the approval for it. But very important that we just understand expectations, and if it's something that you want, great. It's not any different than, you know, saying, oh, I really want this purse, or I really want these shoes. If it makes you feel more confident and you're able to do your job better and feel better, that's what it really comes down to. So, okay? Any other questions, concerns?
Mm-hmm.
You sure? Oh, if you have any questions, please feel free to go ahead and comment. Crystal can watch for that, and I'll answer any questions while we're doing Facebook Live. Even if it's a question like, hey, Nicole's cute. Is she single? Nicole's not single. Hi, Josh. I hope you're at home watching this because your wife's being such a great sport. So Anyway, if you have any questions, please just let me know. And Crystal will be more than happy to let me know what you're asking. If you have any questions after today, feel free to go onto our website, azuraskin.com. You can email us at hello@azuraskin.com. Ask me any questions, give us a call. If I can't take your call right away or answer your email right away, I promise that I will. And also, if you're interested in getting the treatment, you've never had it done, or you have had it done, or you've been in our office before, if you mention today's very first Facebook Live and you say that you saw Jennie and Nicole getting some treatments today, I'm going to go ahead and give you a discount on your treatment. It's $13 a unit is normal. We'll go ahead and do it for you for $11 a unit. So make sure you call and say that you saw us on Facebook Live. And we'll go ahead and give you a discount. Just because it's fun. Why not? All right. Your practitioner should always wear gloves. Whether they're purple or white or blue, always wear gloves. So we're going to use, what's that?
I'm ready.
You're ready?
Mm-hmm.
Okay, good. Let's do this. It's a little bit of an alcohol swab. I'm just going to clean Nicole off here first. I've been to a lot of conferences and a lot of education trainings over the years, and I remember when I was just a young girl learning these things, one of the physicians said, "Oh, you don't need to use alcohol," and still I'll hear that sometimes. You know what? We wear makeup, we sweat, you really should. Okay, we've got a little cold pack here I want to place on your glabella. We're going to do that area first. You're going to feel a little poke and a little bit of a pressure, a little bit of a burn possibly. Be completely honest. Tell them if it hurts, what you feel. Just tell them how it is. Okay. We're going to put this little cold pack on you first. Sometimes the cold, one thing, it just helps with the discomfort, but it also does help to decrease risk of bleeding. We might have a little bit of bleeding today. That's normal. And sticking a needle into her skin, there's potential for bleeding. We don't typically see a lot of bleeding. We don't typically see bruising either. But putting a little bit of a cold pack on here helps to alleviate a little bit of her discomfort, if she has any, but it also helps to constrict the vessels a little bit. So I like to do this just to help decrease both of those things. All right. Go ahead and furrow for me like you're angry. So again, I'm looking for this procerus muscle. It's just popping right out at me. If you're a little squeamish with needles, you may not want to look too much, but go ahead and relax. You're going to feel a little bit of a poke, and you're going to feel a little bit of pressure. Not too bad, right?
Nope.
Honestly, how was that?
On a scale of 1 to 10? For me, it was like a 2.
A 2. Okay.
Yeah.
A little poke.
Just a little poke. A little pressure.
Nothing major, right? Okay, good. All right. Go ahead and furrow for me and relax. You always want to make sure that when your practitioner gets ready to inject you that you go ahead and relax. If you are still furrowing, it's going to be a little more uncomfortable and it's not going to be the best outcome for your injections. And go ahead and furrow again and relax. A little bit of a poke, a little bit of pressure. How are you doing?
Doing good.
Good. You got a little teeny tiny pinpoint bleeding. That's just where the needle went in, but no excessive bleeding or bruising. Go ahead and furrow again. And I'm getting that lateral aspect of her corrugator. I've got the medial corrugator. I'm getting that lateral aspect of her corrugator. Go ahead and relax. A little bit of a poke. Pressure. One more here, okay?
Okay.
Go ahead and furrow. Again, there's her corrugator. When I'm injecting, I'm always making sure that I'm in the belly of the muscle. That's the key. We're stopping communication between that nerve and that muscle from talking through acetylcholine. There's a great term. Maybe I should throw in something for that. If somebody can repeat acetylcholine, or even better yet, which receptor site? Is it SNAP 23? Is it SNAP 25? Is it SNAP 30? Maybe we'll do 10% off a product if the patient can tell me that when they call or when they come in. All right. So glabella is done. We're going to move up to the forehead. For her forehead, we are, not going to knock out her frontalis completely. We're just going to do a little bit of a light treatment, just enough to kind of help her with some of these lines. She's got a little bit of static lines as well as, the dynamic lines when she lifts her brow. So go ahead and lift up for me. So obviously she's got these lines when she lifts, but go ahead and relax. At rest, she still has a line, okay? I cannot erase that for her with Botox or Dysport or Xeomin. Typically it's a combination of things. So I'm going to treat this muscle, the frontalis, and it's going to get significantly better. But as you can see, I can pull her skin apart and there is still a line. It's almost like a scar. So I can't necessarily get rid of that completely, but I can make it significantly better. So it's really important. Expectations are what's most important. I always explain that to people prior to injections, and we've talked about that for a while. Mm-hmm. I think you've been off regimen for a while, so we're getting you back on regimen. Yeah. So I would treat her with, the Botox today that we're using, and then probably have her, use some at-home topical things, like we have some retinol products or growth factor products, making sure we're using the good cleansers. You said you need some toner before you leave today. Make sure she's using her sunscreen, those kind of things. And we'll try to work on that line. Go ahead and lift up for me. So looking for where the muscle pushes and a little bit of a poke, just relax. So, just staying above the areas where I think that she could potentially get a little bit heavy. Can we check in with you in a couple days too?
Absolutely.
Good.
Live?
Well, we can, sure. Lift up for me and relax. Relax.
Okay.
Always make sure you relax. Give her a little bit of a poke here. Again, I'm not trying to just block her completely. Don't want her to get heavy. I still want her to have some motion. A little bit of a poke. How are you doing?
Good.
Good. Go ahead and lift one more time for me. And see, she's also a little asymmetric. She's a little stronger on this side than this side. So go ahead and relax. A little smidgy here. I'll put one little drop here too. All right.
That's it?
Honest. That's it. How are you feeling?
Good.
Completely fine?
Completely
fine. No issues?
None.
Okay. So completely fine. She's doing well. Depending on your pain tolerance, I tell everybody it's more about kind of what's in your mind sometimes than what you're feeling. It is a little uncomfortable. It's a poke of a needle, and there's a little bit of a burn. But a lot of us have, aversions to needles. We're scared. We get a little, worried and worked up prior. Like Nicole here, prior to doing this Facebook Live, she was so nervous. I was like, just calm down. It's not a big deal. You're sitting here. I'm the one injecting. So sometimes you just kind of work yourself up. So, but super easy. Nicole, basically for the next 4 hours, you're not going to lay down. I don't want you to put any pressure on this area. I just injected your Botox into the muscles, and I want them to stay right where I put it. I'm kind of manipulating. I'm spreading around a little bit, in some little areas as I'm, stopping your little pinpoint bleeding. Mm-hmm. But I don't want you to touch the area. Okay. No lying down, no pressure on the area. I don't want you to dissipate or spread that treatment out. Okay. I want you to stay right in the muscles. I don't want you to exercise for about 24 hours vigorously. I know. We were going to go tonight, weren't you? I think we were supposed to go together. So just because, I want you to get the best treatment possible, and I don't want to have any chance of any of that breaking down early. So you can take a walk, you can do normal things, you can exercise lightly, just no running a marathon. Okay? No jumping on the plane tonight, not going to Vegas, we're all good. Other than that, expectations are what's most important. She's going to wake up tomorrow morning, she's not going to see any difference. She's going to wake up, Wednesday, Friday morning. You're not going to really see any difference. Maybe by Saturday morning you'll lift your brows or you'll furrow, and things might be starting to soften up. You're not crunching quite as hard as you were, and then you'll probably forget about it. And then on day 5, day 6, you'll look in the mirror and go, oh my gosh, that's so much better. And then it can take up to about 14 days to get your full response. And you probably remember that from last time. Most of the time, I think you're a pretty fast responder. You typically see results in about a week. Most patients are typically happy somewhere between 5 to 10 days, but it can take up to 14 days for a full look. And that's probably when we'll go ahead and follow her up and see how she's doing. But of course, if you have any questions, concerns, call me before then. Other than that, you didn't really bleed. You're not going to have any bruising. Just no pressure on your forehead, right?
Right.
You're
What
not
about my face washing routine this evening?
This evening, everything's completely normal.
Okay.
Okay. I don't want you to scrub really hard on the area anytime soon, but within, you know, if we go a couple hours, you can wash your face. If you were going out tonight and you wanted to apply makeup, that's completely fine too.
Okay.
Okay?
Mm-hmm.
Any other questions, concerns?
No.
All right,
That
great.
was simple.
Simple, right. So if you have any questions, just give me a call. Again, I'm Jennie Kowaleski, Physician Assistant here at Azura Skin Care Center in Cary. We are right off of Cary Parkway between Tryon Road and Route 1. We've got a beautiful facility here, and I hope to, now that we've made it through our first Facebook Live, we're going to be doing some more of these things. Feel free to comment, even if you're watching this later when it's not live, and I'll get back to you. Feel free to send me an email. You can email us off of our website. And just let me know if you have any questions or concerns. Even if you're not ready to do anything, I'll be more than happy to email you back. Okay?
Okay.
And remember, if you want to come in, mention this video, and we'll give you a nice discount. Okay? Thanks for watching, guys. And anything else, Crystal, that you want to add?
No, ma'am.
All right, go Campbell.
Thank you.
She's been wonderful. All right, we'll see you guys soon. Thanks for watching. Bye.